Welcome to the Aeon Practice Education Series in partnership with Firm Media, delivering concise and impactful insights for aesthetic and specialty medical practices. Your host, Chris Solhonic.
And today we have a very special guest, Dr. Kimberly Evans, board-certified OBGYN, aesthetic medicine specialist, and founder of Sugarland Med Spa. Dr. Evans, welcome to the show.
Thank you so much, Chris, for having me. I love you guys. I think you guys are awesome too. So this is really exciting, and I'm very excited to be here today.
I'm looking forward to doing this as well. Can you tell our listeners a little bit about yourself?
Absolutely. So as Chris said, I am a board-certified OBGYN doctor. I've been in practice going on 23 years now, which I cannot believe it. I started off as traditional OBGYN. I would deliver babies. I'd be up with moms late at night, praying with them, laughing with them, basically just enjoying that precious family time. For lack of better words, as my career expanded, as my patients got older, I realized that there's a whole nother set of stuff that happens as women age. And in my area, there was no one actually doing this. There was no one addressing the questions of, hey, I'm getting older, is intimacy, is it supposed to hurt, like it does? Am I supposed to have these hot flashes? Or, things are sagging and they're not supposed to sag, or I just have brain fog. I mean, the list goes on, and no one was addressing them where I live. So I just took it upon myself to say, hey, these are my patients. I care a lot about them. I know that there's stuff that's out there that can help them, that can help women with a testosterone level of 0. So I sought out to see what we could do to help them be better and live better. And that's really where my passion set in with this whole sexual wellness arena. And I love it with a passion. I love people. I love relationships. I think it's a special type of doctor to take you from, hey, here's a pill and call me in the morning. Hopefully it feels better, to, hey, we have some more stuff that's out there that we haven't even tapped yet, that we can study proven, that we can help you in this area that you're seeking to find out more information about and to grow from. So, yeah.
I always appreciate having someone like you on the show. I don't know if you know this, but most of the time the Aeon Practice Education Series focuses on having guests like consultants or people that work with people in your field, because we're trying to disseminate that information to help people who are on the show sort of have 30 minutes to listen to something and maybe go back to their office and apply something new. But every now and then
Absolutely.
I run across a client or somebody who is doing something special. I have a plastic surgeon in Beverly Hills, which we're going to have on the show very soon. And he's combined plastic surgery with wellness. And that's just it's not the common thing that you see. Or I saw a doctor of ours from San Antonio, Texas, do a social post about the impact of nicotine and marijuana on surgery and healing from a surgery. And so whenever I stumble across someone who has something interesting to say, I always think that's going to make a really good episode. So I'm excited about this. I know that you were just in Vegas. We ran into each other in Vegas at a show, and you were speaking there on the same subject.
Yes, we did. Yes. I learned so much about it, and I got kind of so deep and heavy into it. Not only just from things like medical treatment, but even getting into the cosmetic surgery treatments. And I did so good with treating the ladies that they start bringing their husbands to also get hormonal therapy. So again, it's just all love. And now with knowing so much, I've been teaching other doctors about different products, ways to actually expand their processes, knowing all the things that's out there to help people in this, because really sexual wellness, it is a medical condition. These are things that can bring families and communities together, can get people, you'd have a better day at work sometimes if you were on good accord with your significant other, for example. It's a huge impact. And sometimes my ladies, they may not even be in relationships, but it's just about their overall well-being. So literally, to me, that's all that sexual wellness is about. It may involve one person, it may not. It may just say, hey, what do I need to look better, to feel better? And that's how I've been able to combine the wellness space with the feminine rejuvenation space, with the sexual wellness space. And then now we're actually tapping into mental wellness with our new device called the ExoMind. So it's kind of like the list goes on, but just being able to touch all of these parts that can touch ladies in different ways that their doctor, it may not have time to actually go into depth about or to learn about. So when I came out of medical school, it was just all that was in that textbook. Everything after that was really listening to my patients, educating myself, going to the different conferences, communicating with other doctors in the sexual wellness space, and then literally taking a piece of all of that and combining it, bringing it back to my patients. Definitely this stuff is proven. It really works. It's research driven. I just love to see their reaction when they come back and say, hey, whatever was going on in the bedroom is now fixed, or me and my honey's back together. Or sometimes I even hear couples say, I wish I met you before the divorce papers came through. So we're really able to do something very powerful here.
That's great to hear. I'm so excited about
Yeah.
this episode. You ready to get started?
Yes, please do. Yes.
Okay. You've built a unique practice that blends women's healthcare, aesthetic medicine, and sexual wellness. What inspired you to expand your work beyond traditional OBGYN care?
Absolutely. My biggest inspiration is actually from my patients. I would meet people all the time that would come to me and say that my doctor, they didn't have any other answers for me, or my doctor just ignored my concerns. They didn't listen to me. They did my well woman exam, and I even heard this today. They did my well woman exam, but they didn't listen to my other concerns that were going on. So really being able to heal people in different ways is not only a gift, but it's actually a blessing to be able to kind of to take something to another level than what medicine has to offer, because it just doesn't end there. So my biggest inspiration was my patients, seeing them happy, seeing them come back happy. That just inspired me to go out and do more. And then they come back and say, well, I'm interested in this, or I'm stressed out. So I said, well, let's do something that's going to fix that too. So really, I've built my practice based on what are the needs of my patients, and what are the needs of their families, and being able to function better and live better and things like that. So that's basically what inspires me. And then when I see them do good, I can't wait to go out and share it with other, practitioners, so that I know that they're all on board and learning about what's out there, knowing what's safe, and then too being able to teach. This is exactly how you're supposed to do that process. And I hope I'm not talking too much, but it's just I get all excited about this type of stuff.
You're
So
doing great. You're doing great, and it's
yeah.
really, really good information. This might be a silly
Hmm.
question, but
Yeah.
you're obviously an OBGYN, so you're working with women. You've referred to that a lot in this, but you're doing couples work as well. Is there any work that you do with men?
Absolutely. I do hormone therapy for men. I do sexual wellness treatments for men too. Even our insulin machine, it can treat both sexes. So whenever I have a device, anything, that I have that can help the other sex, I'm all about helping them too. Because literally what usually happens when I see these patients, the woman, she'll be like, oh, everything's great. My hormones are fixed. My love life is wonderful. And then the guy's coming in like, I'm exhausted. This lady is like, I cannot keep up anymore. So you got to fix me too. So literally by listening to the men, I was then able to say, okay, what do we need to help these guys? And, everything from like, the shockwave therapy or the insulin machine or the P shot, including those things. And I've had people, they come, at the same time. I'd have one, the husband in one room, the wife in the other room. They'd be getting their hormones balanced. They'd be getting, their PRP therapy. And it's just beautiful because then they'd be running back and forth, giving each other kisses throughout the process. So it's, yeah. So I love it. I think it's just a cool thing to watch. And again, it's just a different type of medicine and healing when it comes to helping those couples and those relationships.
Sure. I really appreciate that
Hmm.
answer.
Yeah.
So you're well known for addressing sexual dysfunction and helping patients rediscover intimacy. Can you share how
Hmm.
treatments like the O shot and hormone therapy fit into a broader version of overall wellness?
Yeah, absolutely. So this can be for both sexes. As both men and women age, the hormones will decline. In both sexes, you can see things like brain fog, more irritability, not feeling like yourself, overall just feeling exhausted. So sometimes you'll have people on different paths. Like you got one partner who's like, hey, let's get up and go. Let's go do this thing. I don't know, climb a mountain or whatever. And you got the other partner who just comes home and just wants to rest and take a nap. And it's like only 6 p.m. They just got home from work. And then, you got this, this discordance between the partners. So hormone balancing can help even those things out, just like things like the PRP therapy, the O shots for the ladies, the P shots for the men. As again, as both sexes age, you can get a decline in terms of sensation, being able to feel your partner. Ladies can experience moisture issues. Guys can just have issues with it, just take it all day. And you really, again, you want to kind of even the playing field with both partners so they feel like they're on the same accord. They're basically playing great music together at the same time and everyone's in sync. And then, yeah, that's just really how you really help relationships explode in that sense, for lack of better words. So hormone balancing is amazing. again, it does so much other things other than intimacy in terms of energy, helping calm people, helping them just function better in life. The PRP therapy definitely helps for the wellness aspects, like I already mentioned. But when you start combining some of these things together, it's just more of an effect. So that's why it was so important to not just incorporate one, but I really had to have the other one too.
Sure, sure.
Hmm.
I
Hmm.
appreciate that answer. Sexual wellness is often a difficult topic for patients to
Hmm.
bring up. How
Hmm.
do you create a safe space for those conversations? And what advice would you give to providers who want to support their patients in that area?
Absolutely. So, how I advise a lot of providers is this. There's been studies that have been done that essentially showed that patients want to talk about this topic. They just don't quite know how to bring it up. So, literally, if you have things like questionnaires, in our office, we actually have TV sets that are playing that talks about sexual wellness, or we just simply ask them, "Hey, how's your love life?" And then let them complete the sentence. Women, they will just open up like the floodgates and they'll tell you all about what affects them. Literally, they'll give you answers in terms of sensation if it's a sensation issue, or energy level if you need, or hot flashes if we need to affect the hormone, certainly. But guys may be a little bit more quiet. So for them, I would say, hey, most men your age, they may experience this. Are you having any of that difficulty? Or either just saying, like, hey, if you need some Viagra or Cialis or whatever else you may need, I'm here for you. Like, this is what I do. And then they feel much more comfortable opening up and just saying, this is how I really feel, or I had questions about this. So it's not hard. I would say definitely for providers, assume that a lot of people want to ask questions about it. I have 60-year-olds that are running around, 40-year-olds, like the playing court, for example. So they
Yeah.
want that youthfulness. They want to be well. They want to live longer and be stronger and stuff like that. So if you kind of head along those lines and then let the patient complete the rest of the sentence, it becomes really easy to kind of get that information out of them.
Okay. How,
Mhm.
how does overall wellness fit into this? I mean, there's so much uh, emphasis being put on like weight loss and medical weight loss and
Mhm.
fitness and health. How does overall wellness fit into the work you're doing with these patients?
So essentially, when you feel good on the inside, it shows on the outside. Like, I can't put that in much more easier terms. So everything such as, hey, if you have someone who may be a little bit heavier and they want to lose weight, they lose the weight, guess what? They feel sexier and better. They can move better. Their joints hurt less. And then, of course, they may not be in a relationship at the time because literally their mood and their difficult, like their self-confidence is affected. So if you can help them, with that, you've won for that patient. You've overcome one hurdle. Then it becomes, okay, what's next in this aging, journey that we need to tackle? So really, it can all be integrated. Everything from, IV therapy to help you out with your energy, your mood, your get up and go, especially if they can't have hormone therapy, to even like our ExoMind. I got the ExoMind and brought that to the practice. It's a TMS device that's designed to act as an antidepressant. I'm just not a fan of antidepressants because they can kind of kill your sex drive. But literally, it does pretty much the same thing where it releases dopamine and serotonin and all those things like that that make you feel good. In addition, I brought it on for those harder patients where things like performance anxiety, or things like you could have a patient that's with their significant other in the moment, and literally she can't relax in order to achieve that orgasm per se. So
Hmm.
literally, by getting things to help her relax, that's the reason why I brought on the ExoMind to help those subset of women. So literally, again, listening to my patient's needs, that's what really led me to say, hey, this is what we need to try. And like most doctors know, when you start opening the box of to this is what can help with this condition, and this is what can help, with your energy or with your weight loss goals or whatever, the list just kind of goes on and on, because the patient, as she's feeling better or he's feeling better, they're just more excited for, okay, we conquered this, now what's next?
Hmm.
Now what else can we do here? So that's what makes it just so exciting to see, the patients change as they age and feel stronger.
I don't know anything about ExoMind, so if it's all right, I want to explore that a little bit. When you say that, in my mind,
Absolutely.
the
Hmm.
picture I get is like biofeedback. Is it related in that
Better.
family?
It's better. So
But
TMS
in that, is
therapy.
it like similar to that?
Nope. Biofeedback is more like we're having a conversation. This is more like TMS therapy. It's been used for a long, long time for things like treating antidepressant. But BTL is a company where they actually, over the course of the past 10 years, they've been actually developing this ExoMind device to do essentially what I said before. It acts very similar to what an antidepressant would do, but it's drug free, it's hormone free. The patient just comes in, they get their treatment, and then literally less than 25 minutes, they're just out the door. And it's like an instant release. I tried it a couple times, my histamine release, I just felt just
Mm,
overall wellness and calm. It's almost like a little bit of a euphoria per se, but of course, without the drugs or the negative side effects. It's been around for a long time. It's not new technology. It's just what we're introducing it for may be a little bit new. There's been studies that's been done outside the US that actually has studied this effect on compulsive disorders, relaxation, anxiety, and shown that it has great promise in terms of treatment for those.
okay. Thank you for
Hmm.
answering that.
Yeah.
Um,
Hmm.
it reminds me of the way you described it was like going to have the best massage you've ever had, or
Of your brain. Yes.
yeah,
Yes.
yeah.
Yes. Of your brain. Yeah. Literally. Yeah.
Have you
So
heard of
mhm.
vibrational sound therapy?
I have not heard of that.
Yeah, so a friend of mine recently started doing that, trained to do that, and
Hmm.
I went for a session. She invited me to go to the session, and I did the session, and I only did a 30-minute session, and I can't wait to go back because they basically put sound bowls on pressure points,
Yeah. Yeah. Yeah.
and
Yeah.
then they literally, the sound bowl is on your body at a pressure point, and then the vibration goes through your body. And I lay down on the table. They put the cold bowls on me, and then 3 seconds later, I don't remember anything. So
Easy. Yeah. It's there's a whole world out there outside of the regular traditional medicine that we don't know about, that we're just discovering, that literally can be used to treat a whole host of conditions. And I believe that our patients, they're getting healthier, they're smarter, they're all about wellness, they're all about aging better and living better, most importantly. So things like that, I totally support it. Definitely if it helps someone and it makes them feel better and they feel like a weight just left off their shoulders. I mean, definitely, we should all be about all that.
yeah.
Hmm.
So I know that you do more than sexual wellness at the Med Spa. So tell us a little bit more about the services that you're offering there, the more
Absolutely, yes.
traditional Med Spa services.
Yeah, definitely, definitely. So traditional things like facials, we do skincare treatments, body contouring, we do weight loss therapies too, because of course, worst thing about the GLP-1s is, this saggy skin and this loss of muscle tone. So literally by incorporating some of the devices that can actually not only help reduce the fat, but also tone the muscle, that's huge. But in addition, my M-Sculpt nail machine in particular, that's something that also not only is an aesthetic device, but it actually treats and helps with functional wellness. So what that means is that as people age, they may feel, a little weaker in one leg than the other, or if they have like a certain injury, these same devices can actually be used in the functional wellness space to actually help tone and rehabilitate those muscles, which I think is the most, exciting thing. So like football players, my son is a football player. I put him on the machine when he had a little bit of a knee injury and he instantly felt better. So I'm so excited about where this whole field of medicine and wellness is taking us. And that's just one set. We're also, one of my other favorite things I do too, aside from doing feminine rejuvenation treatments and the hormone stuff, is that I also do cosmetic gynecology. So there is, again, listening to my patients, there's a certain subset of women who, there's things where babies has affected us. We could have leakage of urine. We could have just things just look a little bit unsightly in our swimsuits per se. So
Mhm.
literally being able to help women in the surgical department is just like a huge game changer. So everything from vaginoplasties, labiaplasties, vagina angelos, those are all just right up my alley and things that I love because you get like an instant change. So you have someone in their 40s and with 5 kids, and then all of a sudden now she feels like she's back in her 20s all over again.
Mhm.
And just think about the confidence and the thing that it does for the relationship. So a lot of times when I do these procedures, so the guys are like, oh my goodness, I liked it before, but my new friend over there, I like her so much better. So they really get like a kick out of it too, and they really get the full understanding of how these things can affect a lady's confidence, and just wanting to improve, as we age and stuff like that. So it's really cool. It's really cool. I love what I do.
I want to thank you so much for being on the show. I can't wait for this episode to come out because I think people are really going to enjoy it. This is the time in the show where I ask you for your Alm Essential insight. So this is probably directed more at other sort of cosmetic OBGYNs and how they're growing their practice. What's one thing you can leave our listeners with that might help?
Absolutely. Listening to your patient's needs. That is the one thing that I think was a tipping point that was able to help me stop delivering babies and have a little bit less emphasis on the whole insurance world. Because as we all know, things just get a little bit harder and harder in the insurance world in terms of reimbursements and the survivability of a practice. So being able to listen to your patient's needs and affect them in different ways, that's really what has led to not only the growth of my practice through the years, because I think we got incorporated, and I think it was 2014. So our Sugarland Medical Spa has been around for over 10 years now, which is, I think in itself, I'm just like, wow, that's really cool. So being able to listen to my patients, fit their needs, to be able to not only survive, but thrive and just move further. It's exciting for them to see the change. And my patients are so excited now since we're in a new building and it's much bigger. We have our own parking lot, our own building. So I'm really excited about that. But then it's also cool for me as a practitioner to know that, hey, I was able to make them feel special and appreciated today. So it goes both ways. But literally, if you practice like that, you'll always have a job.
Yeah.
You will always be very grateful to your patients. You'll always have this level of understanding of, what you do. And it's just love. It's just love that I have with my patients. So I just really appreciate them all.
Well, I think I've known you for a minute now, and you're transparent and authentic. And I think one of the things you're really good at is helping people to feel seen.
Yes, yes.
I think that's a rare skill. It's a rare skill.
Yep.
So
Because we all matter. I think one of the famous quotes that from the Bible was basically like, it's somewhere in there, but basically God gives us all something special. He gives nobody everything, but we all get a little something special. And how we use that gift amongst each others, that's how we're blessed, and that's how we grow and thrive. And certainly that's how we look good in his eyes. So, not to get too religious, but, really that's the basic principles that keep me going every day.
your purpose.
Yeah, purpose.
Yeah, your purpose.
My thing. Yeah.
That's all the time we have for the show. I'm so glad that you were on, and I'm super excited for this to come out. Thank you for making the time.
Very much so. Me too. Thank you. Thank you. Thank you so much.
Please give us a like and subscribe to stay up to date with the Elm Practice Education Series.